go.
Okay. Thank you, Brittany. Good afternoon and welcome to the Health and Human Services Committee. It's Wednesday, February 21st, and it is 1:05. I want to call the meeting to order. And are there any changes to our agenda today? No. Okay. We do have one person here for public comment. And I'm just going to read the rules for speaking under privilege of the floor. Number 1, I agree to a 3-minute time limit. Number 2, I agree not to raise my voice. Number 3, I agree not to use lewd, obscene, profane, slanderous, or libelous language or speak or act in a manner that would tend to incite a breach of the peace. Number 4, I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of named county employees other than elected officials. Number 5, after 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. And number 6, I agree that if I cause a disruption and am asked to leave, I will leave the chambers. And our speaker today is Zach Wynn.
Good afternoon. My name is Zach Wynn. And I appreciated the presentation about a proposed overdose prevention center last month. I would like to point out what I believe is a major flaw in this approach to managing overdoses. The fact that no drugs are dispensed in the centers is itself the problem. The drug supply is contaminated at its source by fentanyl. Due to market forces, heroin and cocaine have been almost completely supplanted by fentanyl and methamphetamine. Offering addicts an uncontaminated supply of drugs in a controlled environment would eliminate the need for continuous property crime and starve the illicit drug economy of revenue. DA Van Houten discussed the issues of allowing drug dealers to remain part of the equation. The presentation about overdose prevention centers from January's meeting also mentioned a similar wet shelter, dry shelter model for drug users in Bangor, Maine. This is similar to the concept of a wet shelter for alcoholics, where alcohol is distributed 1 drink at a time for consumption on premises in a controlled environment. The crucial missing element is replacing the drug dealers. During January's meeting, it was mentioned that an overdose prevention center in Philadelphia was being explored. I have forwarded links to some documentaries on the drug crisis in Philadelphia. The second link is an examination of harm reduction in San Francisco. And the third is time-coded to an interview with a street user in Kensington, Philadelphia, who describes how xylazine has been insinuated into the drug supply to mimic the effects of heroin. I am sure you are aware of the necrotic effects of tranq dope on human flesh. This potential could be eliminated entirely if there was a return of heroin or its analogs to the drug ecosystem. I also have an unorthodox suggestion. Cigarettes would be a great way to motivate people to get clean and return them to the fold of civilization. A pack of Newports is $16 and change, almost $1 a cigarette. And if you talk to a drug user living rough on the street, all they want is a cigarette. Like a duty-free shop, creating the privilege of buying untaxed cigarettes with cooperation with a harm reduction program would incentivize positive behavior while freeing people in crisis from onerous and exploitative taxation. It should not be cheaper to get high on fentanyl than to have a cigarette. The war against smoking is a class war, and I suggest choosing tobacco as an ally in the struggle against designer drugs, homelessness, poverty, and despair. People smoking meth and fentanyl are not worried about cancer. Smoking a cigarette is the one joy many people can experience in a day. It is a better addiction in every way than to the drugs you are fighting. If the goal is to not only stop overdoses, but stop people from dying, a radically different approach is called for. Please consider finding a way to work around federal drug laws and bring about a real solution to this crisis. An overdose prevention and supervised injection site is a good idea, but it is a half measure. Please account for the economics of the drug crisis and make drug dealers obsolete. Thank you.
Thank you, Zach. We appreciate you coming today. Moving on to the chair's report. I just have a really short report. I wanted to thank county administration for putting together the departmental goals, and we could go through that throughout our meeting here. I also want to say that it's very good to be back to Health and Human Services. I haven't been on the committee for 2 years now, and but I have looked at agendas, and I have watched some of the meetings on Zoom, and there's been a lot of good work over the past 2 years. Also want to thank our department heads for coming to this meeting. I see many of my old friends from 2 years ago, so I look forward to working with you. As far as the chair's report as well, I just want to make the following announcements for liaisons. For the Alcohol and Drug Council, Travis Brooks. For Community Mental Health Services Board, Randy Brown. For the Health Planning Council, Amanda Champion. For the Office of Aging, Amanda Champion. For the Youth Services Board, Randy Brown. For the Human Rights Commission, Susan Currie. And then I will be on the Human Services Coalition. So if there are any questions or comments or anyone wants to change, just let me know and we can figure something out. And next on our agenda is our County Administrator's Report, and Bridget Nugent is here.
Thank you, Shauna. Welcome back. I don't have any specific updates for today's meeting, but as you alluded to, we have included the 2024 department goals from those departments that report to this committee in your packet. So we can take this opportunity for you to review them, and we do have representatives from each of the departments if you have any questions or comments.
Thank you. You know, I think it would be great if we could go department by department, and maybe if each director might be able to talk about their 2 top goals. Oh, sorry about that. Hi, Kate. How you doing? We noticed your hands up.
Good. Good, Sean. How are you? Good to see you. Just for the liaisons, I didn't hear anything about the rec partnership, and we will need we have 2 seats there. Randy and Travis were the 2 seats from last year, so I just wanted to bring that up.
Okay. Is there anyone that would like to do the rec partnership? Randy is a thumbs up? Okay. Do you happen to know when that meets, Kate or Randy?
It is we meet the 27th, so they meet just a few times a year, and it would be the 4th Tuesday of the month, and it's online from 5:30 to 6:30.
Okay, and Travis Brooks has volunteered, so thank you both. Thank you for reminding us. Hopefully we're not missing anything else, but if we are, then we can assign those for our next meeting. Great. So for our departmental goals, why don't we start off with Lisa Monroe from the Office for the Aging. Hi, Lisa.
Hi. Welcome back, Shauna and Amanda, too, to our advisory board. That's awesome. Yes, and I had to quickly pull up the goals because I didn't have them handy, so I just quick did that. And you're looking, I don't have any other report either. Are you looking for a report? Yeah, I don't have anything else to really discuss today.
Okay.
And as far as our goals, you know, these goals that I submitted, these really are in addition to what we're doing regularly in our office and what our plan indicates for that NYSOFA approves for us. So these are additional things and some changes that have been, I'll point out the 2 that are kind of right on our plate right now.
That's great.
They're all hopefully going to happen this year. And I just lost them. Oh, there they are. But the 2 that are most, you know, on our plates right now are really the caregivers initiative, the new T-Care assessment that we're going to be required to do for caregivers. We do work with caregivers on a regular basis in our office. We have a caregiver coordinator, a caregiver resource center where we do workshops and support groups and counseling, options counseling more or less. But this is going to be a little bit further of a stretch for us. We're going to be doing a full assessment on caregivers to help them with more resources, but also possibly provide them with more respite options in the community. So it's something our caregiver coordinator will do in partnership with our ISEP program, which is our case managed. So there'll be somebody following our care receivers and following our caregivers. So that's kind of new to our plate, just started in October, really just getting pushed forward right now. So that's that. And if I could pick another one, I guess the healthcare facility transformation grant that we're working on with Cuca Health Partners and the Human Services Coalition. So we're going to be part of the first cohort community-based organization to, as a referral source and as a navigator source too. So our office will kind of play 2 roles in that. We'll be working with Whole Health, Cornell Cooperative Extension, the Human Services Coalition, and us will be like resource navigators. Are going to be kind of determined based on age who comes to us. So we'll be receiving these referrals from providers in the community to help them with health-related social needs. So we'll be navigating people, but we'll also be directly providing them with services because that's what we do. So those are the two main things that we're really working on right now.
Great. Thank you, Lisa. Any questions from committee members or comments? Amanda?
Well, just not really a question, but just talking about goals. I mean, number 3, you have onboarding an additional home health aide, and I know that's been a challenge getting people to, want to do that job. But I guess maybe just something for us to learn more about this year or be updated on is what is happening in that arena, because I feel like I haven't heard much about it in a while, so.
I can speak to a little bit now. So we do have one part-time person that is a home health aide that works for us, and she serves, over the years period, she served up to about 25 different people. Regularly, she's serving probably maybe 8 people. Some are weekly, some are every other week. And just a few hours a week. It's really to kind of fill a gap before we can get someone some more service with an agency. So it's kind of like that unmet need funding that we use to do that. We definitely want to hire another one, but the governor's proposal for our budget is not looking fabulous. So that's a concern of mine before we try to onboard somebody. I want it to be a sustainable position. I don't want to, if we have a flat budget, which would be great, we could swing it. But with what she proposed, it looks like we'd be cut in that area and I would not be able to sustain that position. So I want to know more about that before I get somebody on board, and we can continue to work with the one part-time person that we have. But I will definitely keep you posted on it.
Yeah, thank you.
I guess a follow-up question. Are you seeing right now that the need for that position and those services is way greater than what we're able to provide?
Yeah, I mean, I say yes because it's not gotten any better. There's always been a waiting list. I mean, it's just significantly the same, I'd say, if not better or if not worse, since COVID. And that's not because of necessarily the increase in clients. It's more just the decrease in people doing those jobs, not being able to get the agencies to have the aides to do it. Yeah. In addition to, our role is really to serve the most needy and most vulnerable clients that can't be served in other ways. And they're in situations that aren't the greatest, where agencies will not go into their homes for various reasons, whether, it's mental health issues or, living conditions and things like that. So agencies will just turn that away immediately. So it kind of falls on our office to try to fill that gap. And we've been able to do that with our directly provided aid. So that's been really helpful. So it's a combination of things, why that is continuing to, have a wait list.
And just to confirm, they are receiving at least the living wage. Is that right, Lisa?
Our aides that we directly provide? Oh, yes. Better than the aides will make at an agency typically. At least our contracted aides, because we do know what they make. We monitor that in our contracts. So,
right.
Our directly provided aides are, and plus they receive the benefits. They also get the benefit of having a county vehicle to use.
That's great.
There's a lot of benefits, but what goes in their pocket is definitely more than most people would get.
Okay, that's good to hear. Thank you. Mm-hmm. Next, we have Office of Human Rights. Ken Clark.
Okay, good afternoon. Two goals that I would like to talk about that that really I think take priority for us are related to elevating I should say, working with the Human Rights Commission and County Communications to develop a branding campaign, basically to enhance OHR's public image and encourage the public to contact the office about human rights concerns. That would also be inclusive of the creation of a new logo for OHR. Just recently, we sent the survey, I should say Dominic, sent a survey out to OHR stakeholders, among others. We received 69 responses when at the time the survey closed last Friday. And our staff will be meeting with Dominic to analyze this data, to rank the responses as people were asked questions such as, what imagery or what words sort of resonate when you think about human rights or about this office, in the effort to get a sense of just how the public perceives us and what the public would ask of us. And so we are going to be analyzing that data and the responses and explore the way in which a new brand, so to speak, can increase awareness of our work and serve the community. The second important goal for us is elevating the public profile of the Tompkins Civic Engagement Coalition, also known as Your Voice and Your Vote, which we initiated about 2 years ago. And we had a major kickoff event last year with our first annual Democracy Fest, which was held on August 6th, which is the date of the signing of the Federal Voting Rights Act of 1965. We're planning our second Democracy Fest event for Tuesday, August the 6th, this year, to commemorate the 59th anniversary of the signing of that act, but also to promote civic engagement. We are looking at ways in which to expand our imprint and to engage the public around civic issues. Voting certainly playing a large role, but not the only or primary focus of the coalition. A lot of this is really about civic awareness and civic education. So those are the two things that are of priority for us in the office.
Thank you, Reverend Ken. Any questions from committee members or comments? I just had one question in regards to number 6, pursue restoration of funding for a part-time program and outreach assistant. Can you go into that a little bit more?
Sure. We would like to have the funding for what we had recreated, I should say, as a part-time position, a 20-hour position for a person who would assist me in the development and creation of programming that comes from the office, who would also be working with the Human Rights Commission, and particularly as relates to rural outreach as well, and that would be able to support the work of the office in that way. That funding was not incorporated into the 2024 budget. So the hope is to be able to make the case for the restoration of that funding for 2025.
Okay, thank you. Okay, any other questions or comments? Thank you very much, Ken. We appreciate it.
You're welcome.
Department of Social Services, Kit Kephart.
Hi, everybody.
Hi.
So we have a kind of a lengthy list of goals, many of them kind of not set by us, but by what is happening in the community or what the changes are with funding. I think I'm not sure if I'll be successful at boiling things down to 2 focus areas. What I can say is that we have a couple of highlighted areas. One is, as you know, Shauna, we're busy looking at a countywide team to address homeless shelter needs and look at how, how do we begin to bring forward what we need in that way. We are participating right now on the Safe Options Support Program Planning Group, which is an outreach program that's coming soon. I think most people are aware, but if not, we have been planning with OCFS for several years now around several new approaches to child welfare practices. We have already implemented at our local district the signs of safety, which is a whole new way of assessing and assisting family trying to look at how do we partner with families. So that is implemented, but kind of ever changing, and it hasn't been fully integrated into the system of record that the state uses, which is called Connections. So there's still ongoing work there and things coming that will be impacting our practice there. And then for the last year or so, our staff have been involved in a planning group around what's called the Universal Assessment Tool. That has not been implemented yet, but we anticipate it was actually projected to be implemented this year. Now we're probably looking at a couple more years before it can be implemented. It's a pretty significant change. All child welfare staff will have to be certified every year in how to use the tool. So it's a pretty significant change, but OCFS is working in that direction, and we have the distinguished honor of being asked by OCFS to contribute, and we have been contributing to the discussion around how will it be used, what are the ways that we think it would be good, what are the ways that we think it needs to be modified. We've been participating in that conversation for a couple of years, and we'll continue to do so up through implementation. We are continuing to try to advocate for the HELP program. So if people, I think probably most people are aware that the HELP program is a way to work around some of the civil service challenges to hiring. And so we've been approved, I think you guys, our local legislature, have approved that we can hire through the HELP program for our child welfare staff, which has helped us immensely over the last year. We're hoping eventually that may be something that could be approved for social welfare examiner positions as well. So we're hoping to kind of continue to move in that direction. And then we are continuing to look at and work on human service building security upgrades. Obviously, we're working with county administration on that and doing some onboarding ourselves to try to manage that as well as we can. And then the other area that we are currently working on, and we see some potential large changes in over the year. We are seeing a significant increase in our guardianship population, the Article 81 position. It's Article 81 situation where we are having to go to court related to allegedly incapacitated people. This is something that statewide DSSs are seeing really dramatic increases. We used to, for years, we had one person that we were guardian for. Currently, I believe it's up to 4 or 5, and we are going to hearings every month now, which is something we didn't see for years. And I think, aging of our population in general, and then some of the challenges around there just not being various programs and supports, as well as nursing home options for people, really creates greater need for this. So challenges in that area. So those are all kind of priority. There's really all of what I've got listed are all priority areas, but to boil that down even further, those are the points that I think are most on our list right
Great, thank you, Kit. Are there any questions for Kit? Randy Brown?
Hi, Kit. As usual, you got your hands full and dealing with the hand you're dealt, right? You mentioned outreach workers. I know that's been a discussion because there are many people doing outreach services. Mental health does it, and you're doing it. Other entities are doing it. How do you collaborate with that? How do you know who's doing what? Or
So in our situation, Randy, we only have one person here at DSS that is really formally doing outreach, and that's through our Adult Protective Services division. So, and there is an outreach team that kind of all work together. So he is a member of that team, and they communicate regularly about when they're going to go, say, to the encampment, or if there's somebody who needs outreach that might be living, say, under a bridge, they will work together. Those outreach team members will work together and try to communicate. So it's kind of just an informal group that's developed over time. So we really only have that one position. The outreach team that I mentioned, and I don't want to steal Frank's thunder here, but I don't see him on right. Maybe he's in the room. Is a new initiative that is coming through the Department of Office of Mental Health. That is so that Safe Options Support Program, which is going to provide outreach, is actually coming through that Office of Mental Health at the state level, and is going to be pulling together a team that's run by Catholic Charities in Cortland. And they are going to be putting together a team that we will interface with and make referrals to, but we won't be the oversight for. So it's kind of a different approach. This is a statewide approach, and the state is broken up into regions that are each going to have their Safe Options support team of outreach workers that are going to be providing those services, and then trying to engage people and get them into various services that they need.
Thank you.
So that's kind of separate and distinct from us.
Thank you. More to learn on that. Another issue in discussion is about SNAP, and we talked about that a couple times. And last year, I still want to get on your list and meet with you and see how. I know your applications were up last year considerably, but I'd like to understand that better, and it's on my list to work on that. So.
Sure, absolutely. Happy to talk about that.
Ken, I also wanted to have the discussion at some point this year as far as minor foster care. I know that we've had a local family court judge that has brought forth some ideas, and I know that at one point it was on public safety's goals. However, Rich, John, and I need to have the conversation, because I feel like that very much so does not belong in public safety. Whenever we're talking about foster care, I felt like, quite honestly, it criminalizes kids that, and it puts a really negative spin on kids that don't have guardians or parents to take care of them. And so I would like that conversation to happen within this committee instead of public safety.
Shauna, are you talking about respite or foster care?
I'm talking about respite. Sorry. Yeah, it is respite, in fact. That way we can get an idea on this committee, what the need is. I know everyone kind of has a different perception of what's going on in our community, but it would be nice for us to actually see the data, see what the need is here in our community, and then talk about how we can take care of these kids best. And hopefully, if there's any supplement that needs to happen, we can have that discussion here.
Absolutely. We've, as you probably know, we actually contract for respite through Cayuga Centers, which is in Cayuga County. Although it's one of those things that is just vitally critical to us when we need it. Our numbers have been very low. We started utilizing that like second quarter of last year, and we've had about 5 kids in respite. But I would be happy to come and talk about that and help also cover the parameters when we can put a kid in respite and when we can't. Respite is completely voluntary, so it requires parental support. So sure, we'd be happy to talk about that.
Okay, great. Thanks, Kit. Any other questions or comments? Okay. Thank you, Kit. We appreciate it. You know what? We also have a resolution.
Sure.
And we have a resolution for a budget adjustment grant acceptance, Department of Social Services Safe Harbor Grant, ID 12179. Can I have a mover, please? Moved by Susan Currie, seconded by Travis Brooks. And would you like to give us a little bit of background about the resolution?
Sure, and I texted Kate Shanks Booth because really this is a joint venture here. So yes, I will just say the only reason you're seeing this now is because we get this grant allocation from OCFS every year. We got such a late notification last year that it didn't get input into the budget. But this is something that we get every year, and then our friends at Youth Services really carry out the program. I don't know if you want to speak to that briefly, Kate?
These are funds that do come down, and we have a contract with the Advocacy Center that we provide services to youth who qualify for the sex trafficking, either at risk or have been qualified as sex trafficking. And really, we just use campaign awareness. We do outreach, hotel awareness, those type of things. So it's really just to do for that particular population. So, but again, we don't get that notice until much later, so that's why you didn't see it before now.
Great, thank you. Any questions or comments about the resolution? Okay, all those in favor, please raise your hand. Okay, that's unanimous. Thank you, Kit. I appreciate it.
Yep.
And Kate. Next, let's move on to I think it was the whole health, or I'm sorry, Veteran Services. J.R. Claiborne is here. Hello, J.R. How are you doing?
Hello, how are you? And welcome back.
It's pretty cold to be outside today.
It is. I've got a protected bubble here.
That's good. Would you like to tell us your two, shining stars for your priorities this year?
Yeah, it's funny. I'm looking over those and I realize I wrote them pretty tightly. They're all competing priorities primarily, but if I had to pick, the first one, which you probably Randy and crew and everybody with the downtown facilities will know, is my focus on relocation. I've been waiting probably about 6 months now to get the green light to move to the back conference room so that we actually have a dedicated space to use for the Department of Veteran Services to use. I think if you could see right now, if it could show it, you would see a path right now worn in the carpet between my office and toward the back where our two staff people are. So we look forward to being able to operate from one space. The other thing probably for me is going to be the engaging partners in regards to response for homeless veterans. This is just something that the more I see, the more I'm wondering, like, what can this department do? I shouldn't say wondering, I'm actually looking at what are things this department can do to really help reduce the kind of bouncing around that our veterans have to do when they're trying to navigate resources here available. And so these will be trying to, some folks will hear me soon calling them, but some are departments, but really just trying to figure out how to coordinate something between internal and external resources so that we can try and set up something akin to a warm handoff.
Okay, thank you. Are there any questions for JR? Susan Currie?
I don't have a question. I just wanted to thank JR for his help. I had a woman in my district whose husband had been a New York State trooper who died after 9/11. Not in 9/11, but he went down to help. And she was at a loss as to how to get benefits for her husband. So I started with JR. You were very helpful. We're now working with Ruby, but I really appreciated your help. Thank you.
Thank you. Glad I could help.
Great. I actually wanted to ask Lisa Monroe and JR about accessibility and parking at your current location and see if it's convenient for the people that are coming into your office for services. And I think where I'm going with this is I have a bit of a concern if and when we move into a different building that people might struggle to go to a new building with a lack of parking. And so I know it's a big topic, and I don't want to put you two on the spot, but I also think it's important to talk about accessibility whenever people are seeking your services.
I'll
Yeah,
let
you
Lisa
want to
go
go?
first. We've talked about this a few times, but go ahead, Lisa, I'll follow up.
Yeah, yes, it's a concern. I'll just leave it at that, Shauna. I think you understand that. I've talked with admin about it. JR and I have talked. I think a greater concern that people aren't thinking about also, and this is just me talking here, is that our location currently is where all the human services and social services are. We are a front-facing building, like the rest of the folks that are going to be going over there, but we're the only human services departments that are going to be in that front-facing building. You know, the people that we serve go back and forth between DSS, social services, veterans, all day long, often, you know, during the same day, and they're going to be further away from that. I see it as kind of a barrier for people, especially if they're lacking transportation, already have mobility and access issues. Yeah.
Okay, thank you.
And I would echo that, particularly there's some of our vets who, like when they park over on the Albany side where the handicap accessible parking is, that does not have a curb for them to walk up. They, especially when they're a veteran who's literally disabled, and trying to help his spouse, trying to bring them, his or her spouse, I should say, trying to bring them into the building. That's one thing I look forward to, going in the back of the building, because the door is right there by the parking space. And I've gone out a few times with folks just to help them get back in their cars, so they're not competing with the traffic. But just to having them walking a few steps versus a block or two is very important for those who come in. And it's probably, those are, our older veterans are probably the ones that I see that most important for. But also, like Lisa said, it's, if I'm referring people, it's usually referring them, or they're getting referred to me from DSS. Probably the more distant places, I'll send people to the county clerk's office. But other than that, pretty much things are right here in this area.
Great. Thank you both for being candid. And Randy Brown, fortunately, is our chair for the Downtown Facilities Committee. So you have the knowledge and you can use that in your committee. We won't talk about it anymore here. But I just wanted to make sure that we had the conversation, and Susan's also on the committee. Amanda, are you? No, and I don't think the three of us are. But great. Well, thank you. I think that'll be helpful in us figuring out where we're going in the future.
Thank you for asking about that.
Next, we have Whole Health, and Brenda is here. Brenda Crosby is here from Whole Health. Hi, Brenda.
Hi there.
And Zoe Lincoln is here as well. Hi, Zoe. Long time no see.
Hey, guys. Good to see you.
We were spending almost every week with Zoe during the opioid task force, so we've missed you, Zoe.
Miss you guys too. So we did, I think what Frank and Zoe submitted is really based on our redraft of our strategic plan for the next 3 years. So those are our 4 priority areas, and then the letters under each of the what we call the KSAs or KRAs. Too many acronyms at Whole Health. They all kind of work with pulling together our 2 facilities, both at Green Street and at Brown Road. Zoe, do you want to add anything?
I'll just add a couple of things. I will say that our priority areas they should be similar. They come from our previous version of our strategic plan. We did end up combining one of those. We did have services as a 5th priority area previously, which we've now combined and kind of integrated into some of these other focus areas. And the key result areas also were developed in part from pulling from our old strategic plan that we didn't get a chance to quite get to in that version, as well as pulled from conversations among senior leadership and supervisors and staff. So we put a lot of work into it. We're wrapping up the third and final phase right now. And yeah, I think that's kind of the gist. Happy to take any questions.
Any questions or comments? Randy Brown?
Yes, thank you. Is there somewhere in here that would be an area you're focused on youth mental health? Is that anywhere in here? I mean, I've read through them and I'm sure I don't understand them all.
So there's a lot that's not necessarily pictured in this kind of capture that we've given you here. Within each of these key result areas, we have deliverables that have been specified as well as action steps that have been specified. So there are some things that are more pointed to different groups such as youth or whatnot, but a lot of it is kind of taking a bigger chunk rather than focusing on particular populations. So there may be pieces, deliverables, and action steps that are related to that, but it might not be worded directly that way.
Okay. And on your priority area community, the first one, A, developing network map illustrates overlaps and connections, that sentence. Could you go to build on that a little bit, or?
Yeah, there's only so much, I guess, detail that I can give so far because these are things that haven't quite been taken on by staff yet. So these are things that are coming in the future. And kind of the thought behind that had come from different conversations about really wanting to look at our partners in the community and different stakeholders in the community. A big focus for Whole Health, especially as we move forward in these next few years, are those community partnerships. So community is one of our, as you can see, one of our priority areas. And so that network map is going to kind of be our first step in looking at who else is in the community, how do we interact with them, and maybe how can we streamline some of those interactions. I will say that on the 31st, Whole Health had our all-staff meeting, which we do twice a year, and this was something that we had talked about and started the conversation on in one of our professional development sessions. We did start this conversation of what are some of those community partners, what are our connections with them, and what are community partners we haven't connected with yet that maybe we should be. So.
Thank you, Zoe.
Travis Brooks?
Zoe, kind of, and Brenda, building on what Randy had asked, at some point in time, can we get something that's very specific in regards to mental health and mental health for youth? You are in February, we'll be in March soon. It would be nice to know, it'd be good to know what exactly the goals are related to mental health and specifically for youth for 2024 before we get halfway through the year.
Yeah, absolutely. I think we can work on that. I don't know, Brenda, if you've had other thoughts on that, but we are finishing up the final draft. We're finishing up phase 3 of that final draft. And that'll be something we share widely once we're done with the draft piece of it. I don't know if you had anything additional you wanted to add, Brenda.
Frank is off today, but we will run this by him. I'm sure there's probably some activities going on, but not easily reflected within the strategic plan. But Zoe and I will have a conversation with Frank and try to bring something more detailed. Also with Harmony, who is the Deputy Commissioner at the Green Street building.
Thank you. Any other questions? Okay, I have a few. I just wanted to inform my colleagues as well as Brenda and Zoe. I actually had a kid that needed some therapy, and I called on a Monday, was told to come in Wednesday at 9 a.m. to fill out paperwork. I was there for about an hour and a half, filled out paperwork, and literally walked out the door with a therapy appointment for my kid at their school. And I felt like, we talk about mental health, especially with our youth, and it was really good for me to see how this process happens and, in 3 days be able to walk out with an appointment for my kid. So I just wanted to say thank you. Whenever I walked in, they didn't know who I was, no special treatment or anything like that. But I feel like that's the way that it should be working, and it did. So kudos to the staff at Mental Health. And I think that's really helpful for our community whenever you can get pretty immediate assistance like that. The other thing I was wondering, I know that in the Board of Health, we've talked pretty constantly about reporting on our opioid overdoses, and we've been talking about it for over a year, actually having a dashboard so that we could see how many people are dying in our community. And I think it's important for us to really have that as a focus this year, because we talk about it, but we certainly don't talk about it every month. And it is the leading cause of death in our community. And we're seeing a lot of people, it's not just people in the encampments, we're seeing friends and families, and it's devastating to our community. So I do hope that we can have a focus on those that we're losing, and why that's happening, and how we can help with prevention of those that are dying. And then the other thing that I would like to see happen as far as whole health is whenever we see an amount of deaths in 1 day or 2 days or a week, and we know that it's on overdose, I would like to see some type of notification for people that are using drugs so that they know that there's a bad batch of drugs that are killing people on the streets. And I know that there is a notification. It typically is texting people, but I haven't heard that it's been overly effective. So it would be nice if we could kind of figure something out with that, because I know that I also understand that there are some people that are seeking out fentanyl. There are certain people that don't want fentanyl. And, so I understand there's a balance here, but people, if there are bad drugs on the street, we should have some mechanism to let people know that.
We'll take these up with Frank when he returns. He should be back in the office tomorrow. He just had a couple days off.
Okay, great, thank you.
And Zoe, can you, go ahead, Zoe.
I was just going to say, in response to the opioid comment, Shauna, that I am excited to say that we are getting really close to being in a spot where we're getting close to ready to present actual data. Our fellow Frankie Pirtle has been working really hard on that, along with some other staff members. I'm really excited about the work that's being done there. I know it's taken longer than we'd like to get it out, but it is happening, and it is going to be great once we can get that out to people. Data is a huge focus for us this year, not just opioids, but in a larger aspect as well. So the way that we have it written in the strategic plan right now, I can't remember if we specifically call out opioids, but I can certainly tell you that our efforts, we are specifically focusing on opioids right now. And I'll be excited once we can share that data with you.
That's great. Thank you. Any other questions or comments? Okay, thank you both for attending. And I think we actually have a resolution for whole health as well.
We do.
Okay. Authorization for mural on Human Services Annex, Tompkins County Whole Health, ID 12185. Can I have a mover, please? Moved by Amanda, seconded by Travis. And would you like to go over this resolution, Brenda or Shannon?
I'm going to defer to Shannon.
Hi, Shannon.
Hello, everyone. Thank you. So as you can see in the resolution as it is written, that we're proposing to put forth a community mural. This is a piece that we are hoping will demonstrate and highlight different areas of community resilience over the course of the pandemic and beyond, as well as illustrate continued need for preventative measures for COVID-19, as well as other routine vaccinations. So we have this funding from New York State and the CDC Foundation that is to highlight vaccination efforts and promotion. And the CDC really encourages the use of art to enhance public health messaging. So this is the idea that we have in mind. We'll be working with Ithaca Murals to contract with local artists to be able to put forth a few different concepts, and then we'll be able to bring those concepts back for review once we have them. We're also really excited to be partnering with COFA on this project in order to really lift up our older adults who've been most negatively impacted by the pandemic, as well as incorporate a memorial of some sort to the 100 plus residents who passed away from COVID.
Great.
I'm happy to take any questions if there are any.
Thank you. Amanda Champion?
Yeah, not a question, but this is great. I'm excited about it. I love all the murals around the city. I was a little concerned about the fact that at some point in the next couple of years, the county will probably be selling that building, not using that building. I reached out to Caleb Thomas of Ithaca Murals, and he let me know that they understand that public art is not necessarily permanent. It could be there for a couple of years, and that'll be wonderful. But you know, they're aware of the prospect that this won't be there forever, and so that reassured me. And I think I can't wait to see what it ends up being.
Thank you.
Any other questions or comments? Okay, all those in favor, please raise your hand. That's unanimous. Thank you, Shannon. Thanks, Brenda.
Thank you.
And we've already gone through departmental updates. Oh, you know what? I was missing youth services. It's a hot mess today. Youth services, Kate Shanks Booth.
Hi. I'm actually really excited to get the opportunity to talk about a couple of these. I think our department is really in a good space to move forward on some of this stuff. So the things that pop out to me and I think are most important are increasing our capacity. As you'll remember, we had a position that you guys allowed us to put back in our budget, 2024, youth service specialist. And this person is really, what we've heard from summer camps and other youth serving organizations is that I don't want to say post-COVID, COVID's not over, we still continue to deal with the impacts, but they've been seeing a lot of behavior issues and other type of acting out as a result of the stresses that the youth and their families have gone through. In these summer camps, and the staff that are there don't have the resources and don't really know how to deal with inclusion, how to deal with those things, that on top of those youth that have the mental and physical disabilities that present a little differently. And so one of the things we're really excited about is having this individual sort of be a point of contact in the county for them to call. Obviously, we're not mental health experts, but to be able to provide some resources to go into some of the camps and to help them talk about small shifts that they can make to be more inclusive, a different way to provide a little bit different training for our summer camp youth that are working so that they can kind of begin to think about preventatively before they get into a situation how they might respond to something that they might face. And so we're really excited about that. That's in part, and the rest of it, this person will sustain the work of the next part, which is our project assistant. We've had a gap in that position, which is really sort of impacting our what we had hoped to deliver. The focus really will begin to shift on providing hopefully providing some recommendations for the 2025 budget season for you all to think about how you might be able to invest in youth development. Seeing that, yes, we want to talk about mental health in terms of clinical, and I've had several conversations with Harmony and Frank about how to tighten up our referrals and to make sure that we're supporting youth in both sort of ways, clinical, and then also maybe some more peer-led activities, or just being able to, example, have access to our rural youth services program would be a good example. So we will also be going on a listening tour. County is sort of at the point now with their strategic plan where they're naming priorities. And so really what I want to do is, with the capacity that we're going to have of adding a couple of extra people, really drill down into what we're doing and go out and talk to our community partners, go out and talk to families, go out and talk to youth themselves and make sure we include that youth voice and really get a sense of what we're doing well, what we need to do better, and maybe what's on the horizon so that we can really strategize and put together a strategic plan for our department to make sure that we're supporting the larger county plan, but also making sure that we're supporting our community partners in the best possible way and supporting the youth and their families. So I'm really excited about that one. And then the other one that I really want to highlight, homelessness, right, is a huge issue. We've been talking about that a lot, but a lot of the conversations that we've been having are 18 and older. When you start dealing with minor youth, the conversations and the requirements of the state are very different. And so one of the things that we're hoping to do is do a better alignment. I have a meeting with Cindy Wilcox and Liddy Barger next week to sort of talk about working with the YHDP funds that have come into the county, working with Continuum of Care, and then also hopefully when the county gets the homeless coordinator filled, to make sure that we're keeping the youth on the forefront of that conversation and understanding that they have special needs that we don't want to fall off the table as we're talking about some of the challenges that might face adult or youth who are 18 and older. And another piece that I just kind of wanted to highlight, in the agencies, number 2, I forgot to put the CSEC coordinator position in that. I really focused on the homelessness, but for example, the commercial sexual exploitation, we have a critical team that's made of community partners that really figure out how to best do that education piece and campaign awareness. There is a tool that OCFS has created to have a rapid assessment form, which is like a 10-question questionnaire that a provider can go through with a youth. And then if you answer yes to any of those questions, there's a whole longer assessment that you're required to go through. And up until now, because we have had this funding in our county for so long, before OCFS actually created their assessment, Tompkins County created an assessment tool that we've had and been using. But as time has gone on, the OCFS has required DSS and probation and some other of our community partners to use the form that they have, not necessarily the Tompkins County form. And so I'm really excited to share that we will be switching to using the OCFS form. And I've been working with IT to create a Laserfiche form that's actually going to live online. And it's actually going to be able to collect some data. So we'll be able to have local data in those conversations and be able to talk about, not necessarily obviously not identifiable information, but how many youth are we actually talking about? What are the number of assessments? Where are the referrals coming from? And just be able to speak to the nuances a little bit more around Tompkins County, which I'm really excited about. So I think those are, obviously all of them are important, but I think sort of setting ourselves up for success for the next few years and figuring out how to be better support to our community partners and youth is, I think, just going to be a really awesome time for our department. So.
Great. Thank you, Kate. Any questions or comments for Kate? Randy Brown.
Hi, Kate. We talked a little bit about the recreation partnership through the Youth Bureau and the data and how they present it, and I felt that it could be better. I'm not sure to say that. And it's used primarily, the Youth Bureau and Rec Partnership, by the city of in the town of Ithaca, and it's primarily for younger people. That program, and there's a lot of great things happening there. My daughter went to many of the things at Youth Bureau, but I feel there's an access issue there. For more people could use it, and it could be shared more. So I want to get your thoughts on that.
Yeah, I think, we're dealing with a system that has been around for 30 years. I think on average, I think pre-COVID was around between 5,000 and 6,500 youth. And I think it's decreased a little bit because of COVID. Obviously, they were closed for a period of time, but I think it was roughly about 4,200 youth that they served last year. And the sheet that you're referring to really breaks down all of the municipal partners, and it breaks it down by what programming their youth participated in. And I think use better. I think it would be really great to sort of bring that to you guys. And I'm not sure why that's something we haven't done, but I think putting that forth as a report and talking about data, and especially from the lens of mental health, understanding that getting kids outside, getting them active, having positive relationships with their peers and with adults is a really great way to sort of frame part of the mental health conversation, which I think sometimes is overlooked. So. Absolutely. I have had, Greg is the new Youth Bureau Director, and he's really excited. He came to our department. We had a great conversation. He's really interested in making sure that we're serving all populations and getting the word out to those populations in different venues. And so I'm excited to see what comes of that under his leadership. And I definitely think we can do a better job of advertising and getting it out there. I think when we talk about, I think it's a quarter. The city of Ithaca kids, the city the town do a quarter each, and then the other two big contributors to that are Dryden and Danby are the largest of the rural communities that utilize the rec partnership. So we're doing really good in those places getting it out, but I think Newfield was a great example of in this past year, they just didn't realize what was available. So working with the local municipalities to make sure that we're publishing that information, the Youth Bureau is doing a better job of connecting and getting that out there. And then any way that we can help as a department through pushing it out through, whether it's OpenGov or different venues, I think is absolutely something that we need to do.
Thank you.
Yeah. Any other questions or comments for Kate? Okay. Thank you, Kate. We appreciate it.
Yep.
Okay, now if we could move on to the advisory board appointments. Oh, hi, JR. Thank you. We noticed your hand's up.
Thank you. Trying to find the ever elusive mute button. I just had a couple of things that I didn't get to do for an update. One is that I've been onboarding this month new project assistant. Everyone's talking project assistants. I'm very thankful for mine. Her name is Davi Mosey. She is a Army veteran, which is even better. And she's here working on peer-to-peer activities and such. And she has actually been helping put in place an event. So I want you to mark your calendars collectively. For March 18th, we're going to be having our inaugural Women's History Month event focused on women veterans. And our keynote speaker will be the New York State Department of Veteran Services Commissioner, Viviana DeCohen. So I just want to put that on your radars there, and let you know that you're definitely all invited. Also this afternoon, 4 to 5:30 in Binghamton, but there's also a virtual option. The New York State Attorney General's office is going to do a talk on veterans consumers issues. And this is really focused more about the fraud that happens for our veterans and our active military. Apparently there's a very high level, and it seems like median loss for veterans from fraud is 44% higher than civilians. So just wanted to put that out on everybody's agenda there. If you would like, I just got the virtual link for this evening. I'm happy to share that.
Thank you very much, JR.
Thank you.
Boy, it's awful to think people would do that, but I know it happens.
Yes.
Randy Brown?
I forgot one issue I wanted to talk to Whole Health about. I see Brenda is still here. We had talked a little bit about, I'm not sure the right terminology, but group homes that are no longer staffed, and so people, disabled people and other people have been moved out of the county. And I was wondering if that could get on the list of what's going on with that. And not today, obviously, but learning more about that. And these are 4 to 6 empty homes. And it's a challenge, staffing, I understand, but learning more about that would be great.
I don't have information, but I will share it again with Frank when I see him tomorrow.
Very good. Good idea. Thanks, Randy. Thank you, Brenda. Okay, so moving on to advisory board appointments. Human Rights Commission, Mullen Quay, member, term expires December 31st, 2025. Nyoko Awa, member, term expires December 31st, 2026. Community Mental Health Services Board, Alania Zapp, member, term expires December 31st, 2027. Office for the Aging Advisory Committee, Tobias Dean, member, term expires December 31st, 2025. Tompkins County Youth Services Board, Patricia Buchel, at-large member, term expires December 31st, 2026. Brianna Foster, at-large member, term expires December 31st, 2026. If I can have a mover for those, please. Moved by Travis Brooks and a seconder, seconded by Amanda Champion. Any questions, comments? If there is discussion as well that is needed, we can also go into executive session. So please just request that. Okay, all those in favor of these appointments, please raise your hand. That is unanimous. Thank you all. We have some minutes from January 17th, 2024. If I could have a mover, please. Moved by Susan Currie, seconded by Randy Brown. Any questions, comments, changes? Nope. Okay, all those in favor, please raise your hand. That's unanimous. And are there any comments from committee members, liaison assignment reports?
Just that Cindy Wilcox is here. I don't know if
okay.
you want her to.
Sure. Cindy, do you have any report for us for the Human Services Coalition?
Hi, how are you? I know, sorry, I was a latecomer. So you were talking about goals. I can share a couple that we are working on. We haven't finalized our goals yet with our board, but kind of for the context of our collaborations with the county, I can just highlight a few. One is we're working with county administration and the legislature on the city-county funding review process for not-for-profit organizations. I believe we're doing a presentation on that at HHS next month.
Okay.
Just kind of how we can make sure that we're aligning with the goals of the county and, you know, supporting the organizations in kind of performance assessment and evaluation, application process, those kind of things. So
That's great.
I know that Lisa had mentioned the transformation grant that Office of the Aging is participating in. We're really excited about that project. Our cohort 1 has about a dozen community-based organizations, and the whole idea is to bring social care needs and medical care and clinical care needs closer together so that we can provide better health to our residents. So we're excited about that project in partnership with Cuba Health and also Whole Health and Office of the Aging and many other county folks. We are continuing to provide health insurance navigation to Tompkins County residents, the great unwinding with the end of automatic Medicaid insurance enrollment post-COVID is still with us. So we are trying very hard to ensure that folks continue to be covered via health insurance. So our health insurance navigators are working diligently on that. We have seen our enrollment numbers just spike up kind of exponentially in the last couple of months, which is a good thing because it means we're reaching folks, but and we'll continue that effort. We are working in collaboration with the county on the Mobility as a Service grant. So this is the grant from the Federal Transit Administration. Our 211 contact center is hiring a full-time mobility as a service coordinator that will work directly with the county folks to kind of demonstrate the effectiveness of kind of transportation navigation in the county. So that's a big project we're undertaking with the county. Happy to announce that VITA is back in our community after a hiatus. Thomas Godwin from Cornell University School of, don't ask me, accounting, business. He is kind of leading the charge. We are, again, coordinating a whole bunch of community partners, but we are happy that it is back. And if you are interested in VITA tax support, please call 211 and we will hook you up.
So I'm sorry, what does VITA stand for?
Oh, I'm sorry. Oh, geez. It is the...
or what does it do?
I'm sorry, it's tax...
Okay.
Sorry, so many acronyms. It is tax preparation for folks that are low income.
That's great.
So it's an income-based tax prep program. And we also are working in collaboration with Lifelong, who they also provide tax preparation services for folks that are low income and also meet age requirements. So between Lifelong's prep and the VITA prep program, we can capture a bunch of folks with low income. As we know, it's very expensive to file your taxes and it's very complicated sometimes. So this is basically free tax support.
Great. Any other questions or comments for Cindy Wilcox? Okay. Thank you, Cindy. We hope your arm's feeling better.
Thank you. Getting one day at a time.
Shoulder, yes.
Thank you.
Okay. Any other comments from committee members? Okay. Well, thank you all for coming to HHS today. Can I have a mover to adjourn? Moved by Travis, seconded by Randy Brown. And all those in favor? Okay. Thank you all.